Morning. Thank you for joining me here today. Thank you as well to Dr. Brent Roussin for joining us this morning, and for all your work, Brent. We appreciate it. Today we want to talk to you about hope. About 6 months ago, we were given a glimmer of hope as we eagerly awaited the first shipment of COVID-19 vaccines to Manitoba. Hope that a safer and healthier future were on the horizon. Hope that one day we could and would regain our freedoms. Freedoms we have been giving up in the fight against COVID-19. Freedoms we all miss. Freedoms we want back as soon as we can get them. For the past few months, we have been in a race between variants and vaccines, and the variants have been winning. But thanks to the efforts of Manitobans to roll up their sleeves, the vaccines are now starting to make a difference, and they're starting to win. So far, nearly 1 million vaccinations have been administered in Manitoba, and again, thank you and congratulations to our vaccine team for their tremendous efforts in tackling this historic challenge. Eligible Manitobans have been receiving 1 dose of the vaccine. About 2/3 of Manitobans have got their first dose. And that's a significant accomplishment. And I thank Manitobans for their efforts in getting us to this milestone. But it's not enough. Summer's coming, and the vaccines are here, and it's time for Manitobans to get their freedoms back and enjoy a summer that we all want and we all deserve. L'été arrive et les vaccins sont là. Il est temps pour les Manitobans de retrouver leur liberté et de profiter d'un été que nous voulons et méritons tous. And so today, Dr. Roussin and I are here to unveil Manitoba's 4-3-2-1 Great Summer Reopening Path. It sets out a clear path for more openings and fewer restrictions as more and more Manitobans roll up their sleeves and get fully vaccinated. The 4-3-2-1 Great Summer Reopening Path is going to focus on 4 reopening categories that Manitobans value the most, 3 summer holiday milestones for phasing out COVID restrictions, 2 public health responsibilities that Manitobans must continue to follow so we can ensure that we are safe in reopening and, more importantly, that we're able to stay reopened. And finally, the key to reopening safely and staying open is you getting vaccinated. Not once, but twice, to get your life back. La clé de recouverture en toute sécurité réside dans nos progrès collectifs pour faire vacciner tous les Manitobans éligibles dès que possible et réduire l'impact de COVID-19 sur nos communautés et dans nos hôpitaux. Now I'd like to pass it over to Dr. Roussin to provide further details. Brent, over to you.
Thank you, Premier. Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm quite pleased to be here today to talk about Manitoba's path to reopening. As vaccinations increase, we can start moving towards a post-pandemic Manitoba. And as I've mentioned in the past, a post-pandemic Manitoba is not a post-COVID Manitoba. COVID is likely to be with us for the years to come. The 4-3-2-1 Great Summer Reopening Plan sets out a clear path for more openings and fewer restrictions as vaccine levels rise over the course of the summer. Focuses on 4 reopening categories: gathering and socialization, travel and tourism, shopping and services, and dining out and entertainment. There are 3 summer holiday milestones for the phasing of these phasing out of the COVID restrictions: Canada Day, the August long weekend, and Labor Day. And there's those 2 public health responsibilities that Manitobans can continue to follow to ensure the province can reopen and stay open. Getting vaccinated and following public health orders to lower the risk and the transmission of COVID-19. Each holiday milestone for reopening will have a 1-dose and a 2-dose immunization goal to guide the progress to keep Manitobans safe. The immunization targets are as follows. Over 70% of Manitobans age 12 and up have received their first dose, and over 25% have received their second dose by Canada Day. 75% or greater of all Manitobans age 12 and over have reached their first dose, and over 50% have received their second dose by August long weekend. And 80% of or greater Manitobans age 12 and over have received their first dose, and over 75% have received their second dose by Labor Day. Reopening activity levels will be tied to the first and second dose immunization targets, including meeting vaccine targets by Canada Day means businesses, services, facilities can open up at 25% or greater level. Meeting these vaccine targets by August long weekend means businesses, services, facilities can open up 50% capacity or greater. And meeting those vaccine targets by Labor Day means businesses, services, and facilities can open with very limited restrictions. The plan is built on two key principles: higher vaccination rates and the need for Manitobans to keep following the public health orders. These will be key to ensuring we can see that we can ease these restrictions in the coming weeks to get back to a Manitoba summer. By taking action, changing our behaviors, we can bring case numbers, test positivity rates, ICU admissions down. This will allow us to reopen and start getting our lives back. Public health supports this phased-in approach to reopening. It strikes a good balance between where we are now and where we want to and need to be. This plan also gives some flexibility so we can monitor the situation and make the best decisions based on the data at that time. In the meantime, I urge all Manitobans to get vaccinated. Follow the public health orders, practice those fundamentals, and by making an appointment to get vaccinated, you can make a difference. Let's save our summer. Thanks, Manitobans, and I'll pass back to the Premier.
Thanks very much, Dr. Roussin. Our 4-3-2-1 Great Summer Reopening Path rewards Manitobans with greater freedoms and fewer restrictions on our lives as more and more of us get fully vaccinated. As Dr. Roussin just mentioned, this path forward to reopen safely hinges on Manitobans fulfilling two responsibilities: getting vaccinated and following public health orders to keep COVID away. Vaccines are our way out of this third wave, and frankly, our protection against a potential fourth one that there's been much talk about. And this pandemic is something that we'd like to have over, but the reality is that we have a challenge in front of us to get vaccinated to make sure that we speed the end of it in the short term and in the long term. Les vaccins sont notre moyen de sortir de cette troisième vague et cette pandémie. Les vaccins sont notre façon de reprendre nos vies, à court terme et à long terme aussi. It's time for all of us to get on Team Manitoba. I joined getting my second dose this morning. I'm relieved to have had the chance to do that. I feel good about doing it. I was really impressed and thank the staff over at the Leela site where I went for all the work they're doing. It's a wonderful opportunity for you to feel better and safer by getting yourself vaccinated. I encourage you to do that. We want to protect one another. We want to protect our healthcare system. We want to get our lives back. We want to enjoy the summer we all deserve. Happy to take your questions.
Thank you, Mr. Premier. Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CJOB, Schuyler.
Thanks, Premier and Dr. Roussin, for your time. It's not really clear in this news release what businesses, facilities, and services will open at each phase. Is this like anything from a barber shop to a restaurant to a bowling alley?
Mm-hmm. Yeah, so we intentionally left some flexibility in the plan, but the goal is that if we get these vaccine targets, we can start moving forward with these type of openings, with these capacity limits fairly broadly. But of course, we do have to have that flexibility, and as we get closer to the date, we're going to take that usual process. Public Health will be announcing the specifics of it, giving that heads up, giving that time to prepare. But right at this point, we needed to keep some flexibility there.
Okay, thank you for that. And my follow-up for the Premier, you're a businessman. Dr. Roussin, you made it quite clear yesterday that the slight adjustment to the public health order, which you didn't want to call a reopening yesterday, coming this weekend is there are some businesses that have followed all public health guidelines. They've made their facilities as safe as possible. And given the slight changes coming, the science shows that it's as safe as some of the things you are allowing in outdoor gatherings, but they're still not able to open. I'm just wondering what the message is to those business owners who have done everything and they now know they've done everything the right way, but they still can't see that light at the end of the tunnel until they, maybe Canada's Day.
Well, I think the message is keep doing the right things, guys. Men and women who are running their small businesses, the people who work in them, are the heart and soul of our economy. And we've done our best to, as a government, to offer supports to prop them up to some degree, knowing that we can never make up the horrible, horrible economic consequences of this pandemic. Fully, no treasury can do that. But to position our businesses to be strong, and they are strong and resilient people that run them for recovery. And that's what this plan is about. It sets out a plan for recovery with real hope in it that is not that far away. And I think that's going to be exciting to our small business community, and we'll continue to offer as much as we can supports both during this pandemic and in the recovery period, just as we did last year when we were recovering from that first wave, to our small business community moving forward.
From the Winnipeg Sun, Scott.
Hi, good morning to both of you. This plan talks about having low COVID levels as one of the two responsibilities. It doesn't talk at all about what that actually looks like. What are the targets for things like case counts, test positivity rates, hospitalizations, ICU admissions, and why aren't they in this plan?
Yeah, and so this is really the message to Manitobans on what they have full control over, and those are those two requirements: following the public health orders, getting vaccinated. So this communication is specifically for that. Public health is going to be reviewing all those indicators as we always do, and just like usual, we don't have a set test positivity, right? It depends on the trends, it depends on overall case numbers, depends on the burden on the healthcare system. So we take into consideration a number of those. So those are certainly on public health's agenda. This communication is focused on what Manitobans have control over.
Okay, thanks for that. I'm just looking at these milestone dates and the vaccine numbers attached to them. What happens if we get to August long weekend and we're at the Labor Day mark? Will things open sooner?
Yep.
From CBC Radio Canada, Charles.
Good morning. So, my question for you, Mr. Pallister. Some people are questioning whether the $2 million for the vaccine lottery should have been used to give a raise to our healthcare workers. How do you respond to that?
Well, my mother used to say there's not a lot of sense putting another ambulance at the bottom of the hill if you could put a fence around the top. And I think the message in that was that prevention matters. So preventing a third wave's prolongation or a fourth wave reappearing would be the goal of encouraging vaccinations to happen. And you don't do that by investing even more in a province where we already invest more than every other province in healthcare, education, social services on a per capita basis. So we've thrown hundreds of millions of additional dollars into the pandemic battle on the healthcare side. This $2 million is to encourage people to get vaccinated. Surely we can do both those things at the same time. That's what we're going to pursue.
Thank you. And for the both of you, what do you think about allowing Manitobans to practice sports this summer?
Playing sports?
Exactly.
Yeah. So I think as part of this phased approach, these certainly outdoor activities, we see these moving forward, and you can see as we progress through, high vaccine rates will allow us to return to indoor type of activities as well. So again, we'll have the specifics of all these outlined prior to each phase, but I do think there should be plans for certainly outdoor activities, outdoor sports this summer.
From CBC Manitoba, Bart.
Hey, Dr. Roussin, similarly to what Scott asked, what happens if the vaccine target date comes along and we meet that vaccine target, but there's still a lot of COVID cases, test positivity is still high, and our ICUs are still overwhelmed? What happens then?
So public health is looking at all the indicators as per usual moving forward. We really set these vaccine targets with the idea that knowing that vaccines are safe and they're effective, and if we start reaching these levels, we're not going to expect to see high test positivity or high demands in our ICUs, right? Like I mentioned, and again, not directing blame at anyone, but our ICUs are not filling with vaccinated Manitobans. So we're seeing that protection from vaccine. So we'll obviously deal with what we have in front of us, but we feel meeting these targets are going to put us in a good position.
Dr. Roussin, based on what you just said to me and what you said to Scott, it sounds like this plan is just 3 days. There isn't really any kind of consideration for the other pandemic indicators here. And you said that yourself when you wanted to focus on the messaging about getting people vaccinated here. But I'm going to ask you again, what is the actual plan if we get a fourth wave among the unvaccinated, even when the vaccine target is met?
Well, we'll have to deal with the specifics when we see it. Public health has been managing these indicators all through, and we'll continue to be following them. Remember, the vaccine shifts a lot of the targets we've had before, right? Like it's going to bring down the amount of people requiring ICU admission because they're quite effective at reducing the severe outcomes. So we're going to see where case numbers that before would put a strain on the healthcare system may not put that strain on the healthcare system because we have high vaccine rates. So we're following all these along. So it's hard to speak hypothetically of what may or may not occur. We're going to follow these indicators, follow the burden on the healthcare system, but we feel this plan is setting us up for a safe reopening strategy.
Maybe if I could, Bart, just to back up Dr. Roussin's response there. As an example, today I got my second Pfizer, but I'm reading with concern, as we all are, that the first dose of Pfizer may not work as well at protecting against the Delta variant. Yet it does work well to reduce the severity of the Delta variant. So therefore, there could be a number of cases, but not the same degree of need for hospitalization or ICU as a consequence of more vaccines. So therefore, I guess, just to give a reference point, the linkage to a 70% first vaccine goal for achieving July's reopening with a 25% second dose I think is achievable, and will have the direct consequence of reducing the relative negative consequences that we saw in the past among unvaccinated people, when clearly, if we have 70% of people vaccinated, even though they may contract COVID, the symptoms may not be so severe that they would require hospitalization or ICU care. So we have a ways to go. We're at 67% right now on first vax. We need to get that up a little bit. And 14% on second vax. So we have 3 weeks to get that up to 25. I think that's achievable. I think Manitobans can get behind that target. I think we can do that. I think we can do even better if we all get behind this goal.
From the Canadian Press, Kelly.
So not to belabor the point, but many other regions did tie their reopening targets to vaccinations and hospitalizations. So just to be more clear, why not make that move, especially when you've seen success elsewhere? I think of Saskatchewan or Alberta.
Many other plans. I'm aware of 7 that I've read in detail, and 4 of those have already departed from the stated reopening strategies they announced. So everybody's in a battle against an unprecedented adversarial opponent. We have the ability today to lay out a plan with targets that are very specific and precise, and we have the ability, as we have always done, to lay out public health orders to reinforce that reopening prior to. So I think our next is June 26th, if I'm not mistaken, for public health orders that'll give even more detail to refining this reopening strategy. But we've linked it very specifically to vaccine targets because vaccine levels is one of the absolute key determinants on our progress in beating COVID.
And I know you've both said that these plans were to give people some hope, and obviously the dates are precise, the vaccination rates are precise, but it's a bit more vague when it comes to what the benchmarks are actually going to allow. What is the reasoning behind that? And by outlining them only prior to each phase, is that going to give enough hope?
Yeah, I think so, Kelly. I think the choices other provinces made were to be less specific on the criteria and more specific on the potential freedoms. Then, as you've seen already in numerous cases, back away from those freedoms. That would be, to some degree at least, evidence that we'd be giving false hope to be overly specific in terms of things like you can have 7 people in your yard. So what we're talking about here is what we can do to get our freedoms back. What we can do as Manitobans is get vaccinated. If we do that in these numbers, then we believe these are achievable outcomes. Specific details around the public health orders will be revealed as they have been prior to these dates so that people can prepare, for example, in small businesses or community settings, and that we as householders will know how many family we can have over with or without double vaccinations. These are all provisions that will be contained in the health orders. But this is stating very clearly what our objectives are based on these, we think, attainable vaccine target levels.
From CTV Winnipeg, Jeff.
Oh, hi, Dr. Roussin, Mr. Premier. Could one of you explain what it means, assuming we meet our targets by Labor Day, for businesses, services, and facilities can open with limited restrictions? Are you envisioning 100% occupancy with maybe still mask use or something like that, can you maybe explain what you mean by limited restrictions?
Mm-hmm. Yeah, and I think it really is the goal is to get to a post-pandemic Manitoba where we have public health recommendations and not restrictions. And so when we can necessarily achieve that, we need flexibility. But this plan outlines that we're going to be seeing this phased approach heading towards that direction, where we're not going to have many public health restrictions and hopefully to a place soon where we're just at public health recommendations. So what that exactly looks like right now is hard to say, but those are some of the things that we discuss. Maybe certain areas are, back at 100% capacity. Maybe others have slight capacity limitations. Maybe there's calls for certain distancing in certain places, maybe masks in certain places. So it really depends on what, but the overall goal is to a place where we're relying less and less on public health restrictions and more on public health recommendations.
And on that, Jeff, if I could just add, we're going to have a discussion. I've had a lot of anecdotal comments from people, just again this morning, a teacher saying never been a year where the kids were as healthy. When they were able to be in school, they were healthy. Interesting. And same thing with our sick leave. It's gone down during the pandemic. We're going to have to take a look at what kinds of behaviors we can adjust to and learn from that have helped actually in that respect through this pandemic. Going forward, is the handshake thing of the past, is hugging out, these types of things. We're going to have that discussion. People staying home when they're sick from the workplace, always been a better idea than coming in sick, but many of us have gone in sick. So these are the kinds of things that we're going to have a real good discussion on, and I think engage MB, and I think obviously the health leadership that Brent and his team have provided is going to be crucial as we move forward to make sure we learn from this experience and that we have a healthier society as a consequence.
Oh, okay, thank you. And I'll just use, I guess, the Winnipeg Blue Bombers as an example here. We're talking 25%, 50% capacity, maybe even full capacity, full occupancy by Labor Day. Does this milestone, this target strategy also apply to fans in the stands?
So we can't, again, get into specific scenarios, but that's the goal of this rollout, is that we are going to be lifting restrictions in a phased approach and everywhere, and our goal is to get to a post-pandemic Manitoba where we're not relying on public health restrictions. So the exact timing and exactly what that looks like is difficult to comment on today, but that is the goal here.
From City News, Mark.
If you will allow for the metaphor, it sounds like the ball, so to speak, is in Manitoban sports in terms of doing what you said, the right thing, getting vaccinated for this task. I'm wondering if between now and any of the target dates, we see a rally or a gathering in protest of COVID measures or restrictions or implementations, Manitobans expect real-time enforcement on those rallies being those shut down.
Well, the enforcement we've provided has been strengthened throughout this pandemic. I said in a year-end interview with the media that I regretted that we did not have stronger measures early on. We were really relying totally on, pretty much totally, on information and education to persuade people, and that still has been the cornerstone of the approach we've taken in partnership with public health. But enforcement matters. And so anyone that's disrespecting the public health rules should understand that there will be consequences for that.
Thank you. If for some reason we collectively were doing amazing, and by our second target date we were already closing in on the third, could we see any acceleration to this plan or past reopening?
Yep, absolutely.
From CHVN, Taylor.
Hi, good morning. Manitobans are used to very specific health orders. These reopening plans are pretty vague. A lot of folks were looking for information like how many people can gather when businesses can open. Why do we have a reopening plan without these things that people were wanting to know?
Well, actually, Taylor, I think you got it backwards in a way. We're really being specific on the benchmarks that have to be achieved so that we can proceed with the reopening details. I think that you're confusing public health orders with a reopening plan now. The fact of the matter is any reopening plan is going to be based on these criteria that we have outlined in great detail in this plan and that are key to achieving the reopening details, which are announced in the public health orders on a regular basis.
Thanks. And in September, things are set to open fully. That's also when schools are set to reopen with kids who at this point aren't able to be vaccinated. How is this being considered when it comes to September reopening?
Well, when we look at population benefits of a high vaccine uptake, that protects us and protects individuals who are unable to get vaccinated for whatever reason. So high vaccine uptake, high two-dose vaccine uptake, not obviously protects the people who have been vaccinated, but also protects people who are unable to be vaccinated because we have less and less ability for the virus to transmit. So we're looking to a place in the future where we can rely on those population level benefits of high vaccine uptake and not have to focus on those who are unable to get vaccinated.
From the Winnipeg Free Press, Danielle.
Good morning. I have a question about the interpretation of the vaccine coverage rate. So, for instance, in Saskatchewan, they've said that 3 weeks after 70% of the eligible population is immunized with a first dose, most restrictions could be lifted. What's spelled out in our plan is more conservative. I'm just wondering if you can explain why there are these differences in the interpretation of vaccine coverage rates.
So really what on our plan, you can see that we have a significant focus on second vaccine uptake. And this was largely at the timing of while we made this plan, we see the Delta variant circulating in many jurisdictions, and we certainly detected it here. So we wanted to ensure we have adequate second dose uptake to guide our response. So we've set these targets up that we feel will allow a phased and safe opening, but we also set them as achievable. Looking at the supply of vaccine and our rate of vaccine uptake, we think these levels are achievable by the timeframes as well.
If I could add, Danielle, as well, remember that Saskatchewan's plan obviously was presented earlier, that the Delta strain wasn't as big a factor at that time. I'm not covering for Scott Moe. I'm just saying they made a plan. They've had to delay some of the liberty restoration that was part of that already. You're seeing in Great Britain right now, the dominant strain is the Delta strain. They've had their highest case numbers in months. So our plan, yes, is more conservative and cautious in that respect because it's more realistic, I think, based on second vaccines. Because first vaccine is not very effective against Delta. It's 50%, Brent-ish? Okay, so it's better than nothing, and it reduces the symptoms. But it's the second vaccine you have to get to really reduce that likelihood of getting infected. So our plan's based on second vaccines in combination with first. We have thresholds that need to be hit. Those are hit, we get our freedoms back. It's that simple.
Thank you. And my second question is for you, Premier. The Manitoba Nurses Union has voted in favor of a strike mandate. Can I get your reaction to that today? Sure.
Well, we're going to continue to negotiate, but not in the media. We spent 2 of the last 4 years sorting out the bargaining structures to get them down to the point where they look more like the rest of the country. Frankly, we had 150 plus, I think, in the WRHA alone of bargaining structures. So that took some time. And I thank all the unions that were involved in that partnership and that discussion for achieving the goal of bringing us down to a better structure. Now we have to use that structure to negotiate, but I won't be doing that through the media.
From Global News, Brittany.
Good morning to you both. Right now, currently, only people who got their first shot before May 4th are eligible to start booking for their second shot. And we know that people are already booking into the second week of July for this. You've said you're hopeful that these are achievable, but how do we know that based on the vaccine supply that we have and when people can't get their second shot before that first target date?
Well, they don't all have to, of course. We have to get to 25% on second shot, and I think our projections are safely there. Again, Brittany, we've had some supply challenges throughout, as everyone has to deal with throughout this pandemic. But conservatively, I think if Manitobans continue to book and follow up and have their appointment that they booked, we should be in great shape on that one. So it's getting into that second loosening at the end of July and at the end of August that's going to require us to get much higher numbers. And as you said, people are eligible, and that eligibility has been broadening every couple of days, I think, for more people to be able to get their second vax shots. So just encouraging everyone to do that.
Thank you. And what happens if, when we come to these target dates, we've only hit, say, the first dose target? Will people who have 2 doses get special privileges? Are we still going to be able to reopen somewhat if we only hit one of the 2 targets?
I'm going to give you the same straightforward answer I gave on if we do better. If we do worse, then we're not going to get our freedoms back as fast. If we do better, then we might get them back faster. It's as simple as that.
Our final reporter this morning, Mr. Premier, from the Brandon Sun, Colin.
Good morning. Premier, Maxime Bernier is supposed to be touring the province and holding events Friday through Sunday this week. How is the province going to handle these numerous gatherings that are going to be set up along his tour?
Well, he's violating the public health orders. He's going to be light in the pocketbook, and I'd suggest that he not violate the public health orders, but of course I'm not going to be directly involved in the enforcement, nor should I be.
And I know you don't want to negotiate with the nurses union through the media, but what contingency plans exist to handle a strike if it comes to that?
It won't come to that, I don't believe. I don't think that the nurses want that to happen, but that being said, I want to see the negotiations continue. Tremendous respect for the nursing profession, and the nurses have done amazing work throughout this pandemic. That being said, negotiations are negotiations. They have to happen. They're never pretty, and they're not going to happen in the media. I'll just conclude with a couple of quick things. I announced earlier in the week that you'd be able, after your second dose and 2 weeks thereafter, to be able to travel out of province and then to return without having to isolate for 2 weeks. I am pleased to tell you that that rule also applies to those who come into our province. So if your cousin Bob wants to come over from Vegreville or the Miramichi and visit, and they've got their Bob's got his second dose plus 2 weeks, great, doesn't need to isolate for 2 weeks. So just to be clear. Also to be clear, I've communicated with all the other premiers. I would like to see us take action on a couple of fronts related to this so that we have commonality across the country. I think the sooner we can resume our relationships with one another in this country, the better. The sooner we can have a Canadian family reunion, the better. And the sooner we can do it safely, the better. So I urge everyone to use this as an example of the kinds of things that we can get back if we have our second vaccine. Encourage you to do that. Finally, I just wanted to share with you, I mean, my dad had polio when he was a boy. Some of you know this. He was 12. He was isolated for several months. Couldn't even be in touch with his brothers and sisters. This was in the 1930s, before the Salk vaccine. The reason I tell you this story is that the doctors told him he wouldn't walk again. And a few months later, when he was able to move downstairs in the house and to resume being with his brothers and sisters, he told his mother that he was going to walk again. And he went out in the yard and he tried. And she looked through the kitchen window and told me that she went out numerous times to ask him if he would let her help him up. And he said, no, some things a person has to do for themselves, Ma. For us, right now, we're in a position where collectively we can make a difference, but it really rests on the fundamental decision-making of each of you as individuals. We can get up. My dad got up and tried again and learned how to walk again. We can run again in this province, but we need you all to get vaccinated and get vaccinated again. And you do that, you make that choice, you're helping us learn how to walk again. Thank you. See you soon.